Recording in progress.
We're going to call to order our District Board of Health meeting for Thursday, April 25th, 2024. Can we have a roll call and determination of quorum?
Yes, Chair. Chair Dare,
Here.
Vice Chair Reese,
Here.
Mary Luz Garcia. Here. Dr. Dinko,
Here.
Michael Brown,
Here.
Dr. Clacking,
Here.
Dr. Novak. And I'm Susie Valdespin, your recording secretary. Chair, we have a quorum.
Thank you so much. John Novak, would you lead us in the Pledge of Allegiance?
Please face the flag. I
Pledge allegiance to the flag
To the flag
of the United
United
States of America
States of America,
and to the
with
republic
the
for
republic
which it
for which it
stands, one nation,
stands,
under
under
God,
God,
indivisible,
indivisible,
with liberty.
liberty, and justice for all.
Thank you very much. We're on to number 3. We're looking for an approval of the agenda. Does anybody have any questions about it, or do I have a motion?
So moved.
I have a first, and do I have a second?
Second.
I have a second and a third. That's wonderful. We'll use one of those. All in favor?
Aye.
Any opposed? That passes unanimously. We're on to recognition years of service. Mr. Health Officer,
Chair, we
it
need-
is all yours.
I'm sorry, Chair, can we?
Oh, push
please
my
vote?
button?
Yes.
It's not there.
Yes, not yet.
I would push the button, but it's hiding.
Give me 1 second.
There we go. Okay.
It looks like we missed 2 votes. Give me 1 second.
We're missing 2 votes.
Yes.
Who are the 2? Tell on them.
Give me 1 second. I can't tell because we did it. Hang on a second. I'm going to call for a vote again, Chair.
Okay, we'll call for the vote again. We're having some technical difficulty. Mr. Clacken, if you can just say
Aye.
aye if you agree, okay. Part of the problem is I have, oh, no, it's fine. So, we
Dr.
good?
Denko, do you see it on yours? Okay, Chair. 7-0.
Thank you, so moved. Now to you, sir.
Thank you, Chairman. So we're moving on to recognitions, and I'd like to begin with years of service. We have 2 staff members, both with 20 years of service, that we're recognizing today. Unfortunately, they're not able to be here with us, but Amber English, supervisor in EHS, 20 years of service, as well as Julio Peck Garcia in our WIC program, 20 years of service. So we're very grateful for their service and thank them and congratulate them. We do have a resignation of Leah Gardner, one of our public health nurses, is leaving us for other opportunities. And we also have a promotion. Jesse Latshaw, promoted from EHS trainee to EHS specialist. We have some transfers, so unfortunately, we're losing some great staff members to other county departments. We have Nanette Kano, who has been promoted to public guardian as an estate accountant, promoted to the public guardian's office as an estate accountant supervisor. Rachel Ladd, promoted to community services department as a senior office specialist. And Nancy Ramirez Partida, who has transferred to the county manager's office as an office specialist. And we have with us here today Karina Tomko, who we want to recognize as a health hero. And Karina, if you could raise your hand and let people see where you're at.
Good job.
Yes. So as you'll recall, this is our employee recognition program run by our Health Heroes Committee, and Karina's being recognized for all 5 values: adaptability, trustworthiness, collaboration, inclusivity, and compassion. And I'd like to point out also that Karina is one of our staff that's been with us here for several years in response to COVID-19. So she's one of the people that we've brought on board as one of our disease investigators, and in fact, she leads a disease investigation team. So congratulations to Karina, and stick around, we'll get a picture later. And then we have a couple of honorable mentions for health heroes, Raquel Dupuy Grafton with EPHP, and Carmen Ramirez also with EPHP. And with that, that brings us to proclamations. So I will run down to the podium for those. And we're beginning with Air Quality Awareness Week, so I'd like to ask Francisco Vega if he could join me down there. Oh, Craig Peterson is going to join me.
Is that what I sound like? Wow. I thought I had a deeper voice. Mike, you I think he leaned on it.
I do. That was one of my favorite meetings. All right. Okay. This is our proclamation for Air Quality Awareness Week. Whereas poor air quality can threaten the health of our citizens and visitors, and whereas the increasing intensity, duration, and scale of wildfires has negatively impacted air quality in the western United States, and whereas children, older adults, and people with heart or lung disease tend to be more vulnerable to air pollution, and whereas the Northern Nevada Public Health Air Quality Management Division is responsible for managing sources of air pollution and assuring compliance with federal, state, and local laws governing air quality, and whereas the Washoe County Air Quality Trends Report, which contains information such as national ambient air quality standards, local ambient air monitoring network, and current air quality design values and attainment status, is available at ourcleanair.com. And whereas AQMD implements clean air solutions that protect the quality of life for the citizens of Washoe County through community partnerships, air monitoring, permitting and enforcement, planning, and public education. And whereas clean air will require a collaborative effort by all stakeholders in the region. Now, therefore, be it resolved that the District Board of Health does hereby proclaim the week of May 6 to 10, 2024 to be Washoe County Air Quality Awareness Week in Washoe County, Nevada, and encourages community action to reduce air pollution levels during this week and throughout the year. Adopted this 25th day of April, 2024. Christopher Dare, Chair, District Board of Health. So here's the proclamation. Would you like to make a few remarks?
Well, we certainly appreciate the proclamation and the board's support. My name is Craig Peterson. I am the Monitoring and Planning Supervisor for the Air Quality Management Division. Air Quality Awareness Week is a national event, and the theme for this year is Knowing Your Air. It will highlight resources that increase air quality awareness and encourage people to take action and incorporate air quality knowledge into their daily living. It will also provide an opportunity for us to educate the community educate the community about what causes poor air quality and how people can prepare for and respond to events and environments with poor air quality. As you know, sometimes it takes a large air pollution event, such as a wildfire, to get people thinking about air quality. Proclamations like this provide a great opportunity to get the community to think about air quality, not just during Air Quality Awareness Week, but year-round. To celebrate Air Quality Awareness Week, the Air Quality Management Division is working with the Northern Nevada Public Health Communications team to provide information on social media each day to empower the citizens of Washoe County on the topic of air quality. Daily topics will showcase air quality's 5 Keep It Clean programs: Know the Code, Rack 'em Up, No Zone, Be Smoke Smart, and Be Idle Free. Again, thank you for your support.
Good job to all our air quality personnel that work on all this. We have many of you that worked very diligently. Anybody want to share anything? Very cool. We'll get you a picture in a moment.
Thank you. Do we want to do a vote for all 3 of these proclamations at the end, or how?
Oh, we can go ahead and do a vote now. Sorry about that. I'm looking for a motion to accept this proclamation. I have a first, second with John. Any more conversation? Hearing none, all in favor?
Aye.
Any opposed?
Aye.
That passes unanimously. And push your buttons. Thank you. Go ahead.
All right, next I have the National Bike Month proclamation, and I'd like to ask Stephanie Chen and Brittany Aldea, a couple of our staff members, to come down, and we also have Scott Brighttop with Reno Public Market. So thank you for being here. Whereas promoting alternative forms of transportation such as bicycling helps to improve health and well-being while reducing emissions, traffic congestion, and America's dependence on fossil fuels, and whereas creating bicycle-friendly communities has been shown to improve quality of life by fostering community spirit, improving traffic safety, and stimulating economic growth, and whereas bicycle infrastructure in the Truckee Meadows offers great potential and opportunities to positively impact our recreation and tourism industry by making the region attractive to residents, visitors, and new incoming businesses who enjoy healthy lifestyles and the outdoors. And whereas Nevadans will experience the joys and benefits of bicycling during the month of May through educational and safety programs, community events, or going for an individual or group bike ride. And whereas the education of our entire community on the proper and safe operation of motor vehicles and bicycles sharing the use of streets is important to ensure the safety and respect of all users on Nevada roadways. And whereas the month of May has been declared National Bike Month since 1956, now therefore be it resolved that the Washoe County District Board of Health does hereby proclaim the month of May 2024 as National Bike Month and Bicycle Safety Month in Washoe County, Nevada, and Washoe County Bike Month. Adopted this 25th day of April 2024. Christopher Dare, Chair, District Board of Health.
Thank you very much. Would you guys like to
We've
say
got
something?
another person, so if you could introduce everyone that's here, and here's a proclamation, and if you want to make a few remarks. Brittany?
Stephanie Chen for the record. The Chronic Disease and Injury Prevention Program supports Bike Month to promote and encourage our community to engage in active transportation. The celebration of Bike Month is collaborative, and over the course of May, we have a number of events that will be hosted throughout the community that's organized by our community partners. Brittany here will share a little bit more about our event that we're kicking off in partnership with Truckee Meadows Bicycle Alliance and Reno Public Market.
Brittany Aldea for the record. To commence Bike Month, we are excited to partner with Reno Public Market and the Truckee Meadows Bicycle Alliance to kick off Biketopia. Participants can expect various resources, including helmet fittings and giveaways, bike checks and repairs, and also the chance to win a free bike provided by the Blue Zone Sports and our esteemed partners.
Hi, I'm Scott Brighttop. I'm the Director of Marketing over at Reno Public Market, and we're super excited to host the Biketopia event. Quite a few of our employees are actually avid cyclists. Myself, I am a member of the Reno Wheelmen and a previous board member, so cycling is very close to me. So once we saw that this event could come into our place, we jumped on it, and we're super excited to be putting it on for them. And then we also look at Reno Public Market as kind of like the gateway to the southern part of Midtown, so it's the perfect spot for all the people that are cycling up through Midtown, coming down from downtown.
Hi, Tom Albright, President of the Board, Truckee Meadows Bicycle Alliance. Once again, thank you, and I just want to emphasize how excited I am for the opportunity that our community has to allow more people to enjoy safely the benefits of bicycling. We are in an amazing location in such a beautiful place, and it can bring so many benefits from the economic development to air quality, to even the psychological resilience of our kids who get more freedom and decision-making in riding bikes. So once again, thank you, and I look forward to seeing you at the event if possible, and if not, on the roads or paths someday. Thank you.
Any comments from our board? Sure.
Thank you, Mr. Chair. First of all, thank you all, 4 of you, for being here. Dr. Albright is a frequent visitor at City Hall as well, and it's always a privilege to see Truckee Meadows Bicycle Alliance working through and for the benefit of this community. So I very much appreciate that. It's also fun. The collaboration with Reno Public Market is pretty exciting. I've spent a few evenings there of late, and it seems like it's very busy all the time. And I do notice that people are biking there, both there and back, and so that's pretty exciting. What are the details for the Biketopia event? Can you let us?
Can you come to the mic and say your name again? Sorry.
Scott Breithaupt, Reno Public Market. So yeah, the event is this Sunday from 12 to 3 o'clock. We'll have interviews and bicycle equipment, helmet, and safety knowledge going on throughout the entire time. So it's kind of like a 3-hour show. Kind of pop in, learn something new about cycling as the time goes. Plus we'll have, I think it's 15 different people coming in from various nonprofits, cycling clubs, bike shops, etc.
And one more time with the time for it.
Oh yeah, 12 to 3 p.m. on Sunday.
Perfect, thank you.
Go ahead, sir. Just state your name again for the record.
Tom Albright. I wanted to add one thing because it's kind of late breaking. I'm so excited about it. After the event at 3 p.m., we'll be having a mural tour of all the historic murals in the area, led by none other than Jamie Chapman, who happens to be a TIMBA board member and an expert on our local murals. So if you want to ride your bike and check out some murals, it's a great opportunity.
Thank you. And I have one thing just to share with you, and this might seem a little personal to me, because my father is the one that wrote Wear Your Helmet and did all that stuff in schools. And that music is, just see me afterwards. He did pass away, but all that music is free to you to use, and it's stuff for the kids. And so please get my information. I'd love for you to use all of it. Thank you.
Thank you for sharing that.
Mr. Chairman?
Yes.
One more comment before you all leave. I love seeing Northern Nevada Public Health partnering with our business community and working with our nonprofit community is really an amazing collaboration. And Dr. Albright is involved in a lot, and I wanted a shameless plug for another upcoming event coming up on Saturday, May 18th as part of Bike Month. We are working with different agencies like the RTC to highlight what is very near to us here at the complex at the county, to highlight the Audie Wells Boulevard pedestrian and bicycle facilities and improvements that have happened, which have been incredibly transformative for our neighboring communities here. And we invite you all. I'll be checking out Biketopia, but I'd also like to welcome the public to attend Saturday, May 18th from 10 to 12, which will start and stop at Paradise Park, go through Sparks, turn around at the Sparks Library, and then come back to Paradise Park. And it's open to children, adults, and seniors, and adaptive bicyclists. So please join us.
Very cool. Anybody else? With all that said, I am looking for a motion.
So move.
I have a first and a second. Any more discussion? With our first and second, all in favor?
Aye.
Aye.
Any opposed? Seems like that passes unanimously. And please don't leave. We want to take a picture with you. Yes, we do.
All right, next we have our, whoops.
I'm sorry? Oh, I did. It got stuck. It just stuck on green.
All right, next we have our EMS Week, Emergency Medical Services Week proclamation, and I believe we have a number of EMS representatives here in the audience, so if I could ask everybody to come down, and Sarah Smith with Northern Nevada Public Health is going to also be accepting the proclamation.
Come on
So I got a
down.
stack of them here. Thank you. Whereas emergency medical services personnel are called upon to help others through one of the most frightening times of their lives, and whereas emergency medical services is a vital public service with personnel ready to provide life-saving care to the community 24 hours a day, 7 days a week, and whereas access to quality emergency care dramatically improves the survival and recovery rate of those who experience sudden illness or injury, and whereas the emergency medical services system consists of men and women in both the public and private sectors, including emergency physicians, emergency nurses, emergency dispatchers, emergency medical technicians, paramedics, firefighters, educators, administrators, volunteers, and others throughout our healthcare system who work together to ensure those in need receive the highest level of emergency service. And whereas the EMS commitment to patient care throughout Northern Nevada has been an integral factor in our safety and security, and whereas Washoe County is proud to have organizations such as Reno Fire Department, Sparks Fire Department, Truckee Meadows Fire Protection District, North Lake Tahoe Fire Protection District, Reno Tahoe Airport Authority Fire Department, Pyramid Lake Fire Rescue EMS, and Remsa Health operating throughout the region to ensure the highest quality of patient care and community support. And whereas the members of emergency medical services teams, whether career or volunteer, engage in thousands of hours of specialized training and continuing education to enhance their life-saving skills. And whereas it is appropriate to recognize the value and accomplishments of emergency medical service providers by designating Emergency Medical Services Week, now, therefore, be it resolved that the Washoe County District Board of Health does hereby proclaim the week of May 19th through 25th, 2024 as Emergency Medical Services Week with the theme, Honoring Our Past, Forging Our Future. Adopted this 25th day of April 2024, Christopher Dare, Chair, Washoe County District Board of Health.
Very cool. You guys have anything you want to share? Who's going to speak for you? Or all of you, whatever's.
I didn't come prepared, but I'll say something. I am the newest member of this team of collaborative partnering agencies that provide EMS services to our community. These people are so dedicated and hardworking, and although not all of our partnering agencies are here today, it's so obvious to me how much they contribute on their day-to-day, week-to-week, month-to-month. So thank you very much for your support and being able to recognize these really hardworking people.
You're very welcome. Any comments from the board? I would just echo everything that we just read, and thank you for running towards danger and towards people needing help when everyone else kind of freezes or runs the opposite direction. That's a big deal. So thank you so much for all you do. And so now we are looking for a motion for this.
So moved.
I have a first and a second. Any more discussion? Seeing none, all in favor?
Aye.
Aye.
Any opposed? Passes unanimously, and we're going to come on down and join you.
We got AI now, so you don't even have to worry about it. Got it. All right, 3, 2, 1. Very good.
Solo Kevin in the middle. It's a big day. Okay, we are now on to public comment. Do we have any public comment?
Yes, sir, we have one public comment, and I'd like to read a message before we call public comment.
Sure.
All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The District Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. For Zoom users, please log into the Zoom meeting via the provided link and utilize the raise hand feature during any public comment period. To provide public comment via telephone only, press *9 and *6 to mute and unmute. Reasonable efforts will be made to hear all public comment during the meeting. First, we have Molly Rose Lewis from Senator Rosen's office.
Hi, folks. I'm back again. Just wanted to say hello from Senator Rosen's office. I'm here again to listen and see how we can help you on the federal level. So please keep me posted if there's anything we can do with grants or even constituent services or specific issues with things like Medicare. So please keep me posted, and happy to be here again. Thanks so much.
Thank you.
We have no additional public comment, sir.
Thank you so much. We're moving on to 7, which is consent items. Would anybody like to pull a consent item, or I'm looking for a motion? I have a motion and a second. Any more discussion? Seeing none. All in favor?
Aye.
Aye.
Anyone opposed? Looks like that passes unanimously. Please push your buttons. And we're moving on to Regional Emergency Medical Service Authority. Come on down.
Good afternoon, Chairman Dare, members of the board. I'm Barry Duplantis, CEO and President of REMSA Health, for the record. I understand each of you have been provided with a copy of REMSA Health's March report for March. I'm very excited to say, and also too for the year to date, not just March, but both March as well as fiscal year to date. REMSA Health has been fully compliant with its priority 1 on-time arrival in all franchise zones that are described in the franchise agreement. We came in at 91% in Zone A, as well as in 91% in the BCD zones. I'd like to point out that in the month of March, we responded to 7,872 priority 1 calls and transported 4,851 patients to area hospitals, and that was actually up about 5% over the previous month. That said, no particular reason that's in common. It's just random needs for ambulance service. Our average franchise response time for the month was 5 minutes and 51 seconds, as compared to 8 minutes and 59 seconds as stated in our franchise agreement. The one thing I would also like to lastly say is that April is the National Donate Life Month, and we, as an emergency responding agency, certainly collaborate with all of our organ donation organizations that are out there. Because when it comes to addressing matters of life, it's not just with the dispatch and the presentation of an ambulance. And in fact, I would even go so far as to say oftentimes we also engage with the trauma intervention program, where we provide care after the ambulance has already left, because families are often left with traumatic circumstances. So that's my report for today. I'm happy to entertain any questions, any comments that any of the members may have.
Any questions or comments? See none, I just want to say thank you to you and your team and their families for the sacrifices made all the time. And this is a very good report. Thank you. It's good to see your numbers. Appreciate it.
Thank you.
Thank you.
Want a motion, Chair?
Yes, I do.
Motion to accept. Thanks, Barry.
I have a first and a second. Any more discussion? See none, all in favor?
Aye.
Aye.
Any opposed? And that seems like we pass unanimously. We are moving on to 9, presentation and possible acceptance of the 2022 to 2025 Community Health Improvement Plan 2023 Annual Report. Okay. Rihanna Lavoie. Did I say it right? Lavoie?
Yep, Lavoie's right. Good afternoon, members of the board. Rayana Lavoie, Management Analyst for the Office of the District Health Officer's Office. Today I'm going to present the 2023 Annual Report for the Community Health Improvement Plan. I will refer to the Community Health Improvement Plan as the CHIP. To give you some background information on the CHIP is a community-driven improvement plan. However, Northern Nevada Public Health is tasked with collecting data, tracking the progress of activities within the CHIP. We also act in many cases a convener or facilitating conversations around strategies to improve the health of the community. And then we also prepare this annual report. The CHIP was created using the community health assessment data, which showed us where there were opportunities to lean in based on health disparities, as well as the health status of the community. The annual report is a highlight of the activities that we accomplish with our community partners in the first year of implementation. And at the end of my presentation, I will also tell you about what we're focused on in this year. Something that I want to highlight that's an important piece of the CHIP cycle is we use data to inform our approach in implementing strategies to improve the health of the community. So we do a comprehensive overview at the beginning of the CHIP cycle to ground us where the needs are, and then we also regularly meet with our partners to talk about new data, resources, and we also talk about our capacity to ensure that our approach aligns with the evolution of our community's needs. Now that you have the background information about the CHIP, let's talk about the progress that we've made as a community. The CHIP includes 4 focus areas that encompass a combination of targeted as well as some strategic initiatives that are addressing and how we improve the community's health. At a very high level, 71% of those activities that we plan to implement in year 1 were accomplished. Again, this presentation will cover a highlight of some of the initiatives, but you can find the annual report on our website, and that covers all of the details. The first focus area is social determinants of health, which is a very broad topic, and we've narrowed that focus area down to really focus on our built environment as well as our social environment. The work groups made progress by completing 70% of the deliverables in year one, and we're going to start with focusing on Golden Groceries, which is a partnership between the Northern Nevada Public Health, some other partners, and the Food Bank of Northern Nevada. And this initiative is targeted for our senior population, and it is designed and created to offer pantries that increase access to food for the senior population during convenient hours that they like to grocery shop. This operation is located in 5 areas throughout Washoe County, and to give you an idea of where these are placed, we are trying to meet the community where they're at. So one location is at Reno Housing Authority's Tom Sawyer location, just right around the corner. And this is where a site that offers housing subsidies for seniors. So again, just meeting that population where they're already at. Something to note here, this initiative launched right around the same time that the food bank was seeing an increase in the number of seniors who were accessing pantries more frequently. And this was likely due to the end of SNAP benefits or the expanded benefits that they were receiving through SNAP around April. So without those additional benefits, seniors have been unable to purchase food with inflation in those grocery stores. So this effort was timely. Also included in the CHIP are efforts to improve language access in our community. This is a critical piece to achieving health equity and ensuring a quality of life for those who might be experiencing health disparities. Washoe County Human Resources and NPH staff, as well as other county departments, have been working together to build a language access plan that establishes a framework to follow when providing services or interacting with those who are experiencing limited English proficiency. Our second focus area is mental health. And this area includes 7 initiatives, and about 60% of the deliverables in year one were accomplished. This focus area spans across many areas of mental health, the first being efforts to safely store guns and lethal means as one strategy to decrease the number of suicide attempts as well as deaths. A lethal means coalition was created, and this coalition is now building an accessible map of gun-safe storage locations, and they're also working to educate the community about gun safety. Additionally, NNPH is working with partners to provide Acá Entre Nos sessions within the community, and this initiative brings Spanish-speaking families together to reduce stigma around mental health through group discussions about related topics, as well as bringing them resources available in the community. This effort is brand new, and it successfully reached about 80 individuals in our community, and we're hoping to expand this effort again this year. And finally, we have the Washoe County Adult Crisis Response System. The Washoe County Coalition continues to work to implement strategies in the Washoe County Crisis Response Implementation Plan. Most of the work in year one really focused around completing the foundational elements needed to stand up the crisis response system, such as developing training plans, developing MOUs, also developing and piloting a familiar voices strategy, as well as collecting data from existing providers. The third focus area is preventative health behaviors, where there are 4 initiatives. About 20% of the deliverables have been met in this area, and that's really because we needed to redirect some efforts with limited resources, so that's what we've been focusing on this year. We'll start with the 5210 program. This program became statewide this year with activities focused on expanding the number of providers who are adopting the program in their clinic settings to be able to educate families on healthy habits. NNPH has also leaned in to provide technical assistance to our partners down in Southern Nevada, as well as the rural areas who are now looking to implement 5210. And then, of course, we've also expanded the number of schools who are adopting the program. So really the focus there is to turn cafeterias into smarter lunchrooms, as well as incorporate opportunities for students to get active. We now have 7 schools who are implementing the program. To expand on this endeavor, we're also working with partners to create healthier neighborhoods within communities with the same idea of creating healthier environments where the healthy choice is the easy choice. Our very own chronic disease and injury prevention team has expanded the number of convenience stores who are now a Healthy Corner store by offering healthy produce as well as recipe cards in areas that have low access to grocery stores. We're also looking to expand this effort this year. Our very last initiative is access to healthcare. And we have we have 5 initiatives, and about 85% of those deliverables in year 1 were accomplished. NNPH partnered with the Food Bank of Northern Nevada as well as managed care organizations to deliver GEM events, and that stands for Greet, Eat, and Meet. And really the purpose behind GEM events is to bring information to those who are eligible for Medicaid or those who have Medicaid to make sure that they understand what their benefits offer so that we can increase access to healthcare services. And we've been able to provide 10 events in the community. And then finally, we partnered with REMSA to expand the Choose the Right Care campaign. And this campaign reached many pockets of the community to be able to provide information about accessing the right points of receiving care. So now that you've heard about what we accomplished with our partners in 2023, let's talk about what we're going to do in 2024. We're going to continue to collaborate with our community partners. We're also going to look for areas to lean in to be able to reduce health disparities. So we're actively looking for strategies that are able to achieve that. And then lifting up a bit, we're going to continue to meet with our partners regularly so that we can implement the action plans in year 2. And we're also looking to make sure that our initiatives align with the resources that are available in the community, as well as our community's capacity to ensure that we can address the areas of need. And with that, I'll take any questions that you might have.
Very good report. Thank you. Any questions? I just want to tell you thank you. It's really important that we keep track of what we're doing and why. And there's a lot of continued reading I think we can continue to do in this as well. So thank you so much. I am looking for a motion on this. I have a first. Do I have a second? Second. First and second. Any more discussion? Seeing none. All in favor?
Aye.
Any opposed? That passes unanimously. Thank you so much.
Thank you.
My button's pushed. We're moving on to 10, recommendation for the board to uphold the Air Pollution Control Hearing Board's recommendation regarding appealed notice of violation numbers AQM V24-002, AQM V24-003, and AQM V24-004 to issue a $24,000 total administrative penalty issued to All Eagle LLC for failure to provide the AQMD with written notice of intention to demolish a facility on a date other than the one contained in the original notice as required by 40 CFR 61.145. And it is yours, Senor.
Thank you, Mr. Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. I believe everything has been included in your packet for a decision today, but I would like to highlight maybe the process of how we got here. So it all started with an extremely thorough investigation by air quality staff that identified the non-compliance situation. From there, the information was taken to our enforcement panel, which is tasked in developing a recommended penalty. And so they were able to do that. And again, the tool that they utilize to make that penalty recommendation is the penalty matrix and calculation worksheet that has previously been presented to the board and approved. So just kind of wanted to mention that. And then in this case, it was appealed to the Air Pollution Control Hearing Board. The Air Pollution Control Hearing Board did hear the case and ultimately voted to uphold the recommendation, recommended to uphold the violation and associated recommended penalty. And before I turn it over to any kind of questions, I'll just kind of reiterate that the Air Quality Division always does outreach and education before we ever reach the point of issuing penalties. So in this case, you'll probably see the $24,000 penalty. What I'd like to add to that is that the reason that penalty is so high is because it was a repeat violation after we had issued a warning and worked with the company, and they made the same violation less than a year later. So just want to reiterate again, this is kind of a last-ditch effort where we work with the company, we provide education, outreach. In some situations, this is kind of where we have to go. But with that, I'd be happy to answer any questions.
Thank you. Any questions? I'm not seeing any, and I can attest from what I know that we do the education first, and I appreciate that part of what we're doing. And sometimes we do get to play the wall, that you hit a wall, and this is as far as you're going to go. And so I do understand that. With that said, I am looking for a motion.
Mr. Chair, I move to uphold the decision of the Air Pollution Control Hearing Board requiring appeal November number AQMV 24020304 issued to All Eagle LLC with a recommended total administrative penalty of $24,000.
I do have a first. Do I have a second?
Second.
Dr. Clackey actually beat you, I think. We're going to let him have it.
Good.
We have a first and second. Any more discussion? Seeing none, all in favor?
Aye.
Any opposed? Please push your buttons, and that passes unanimously. Good job.
Thank you.
We're moving on to 11, which is discussion and possible direction to staff regarding the existing NNPH Child Care Inspection Program, proposed changes occurring in the child care licensing in Washoe County, and recommendation to work with the State of Nevada Child Care Licensure Program for NNPH to conduct inspections of child care facilities to ensure a smooth transaction for child care providers, and work internally to develop NNPH environmental regulations for all child care facilities types to be brought back before board for approval. Senor Robert Fida, and with a friend.
Good afternoon, Board. Robert Fida for the record, and beside me is Aaron Myers, Program Senior for Child Care Inspections. And today we're bringing you this item. Staff was recently made aware that Washoe County Human Services Agency Child Care Licensing Program is going away. And that transition is projected to be July 1st of this year. And so what is happening currently is the Washoe County Human Services Agency is working with the State of Nevada Child Care Licensing Program to kind of transition child care providers. Part of our work with HSA was to conduct inspections for child care centers throughout Washoe County. Currently, we have about 100 centers that we do inspect. With this transition, the expectation from the state for us would be to kind of take on smaller family cares that we typically have not done previously that do qualify as child care facilities. And those would require inspections. Those were roughly about another 100 facilities that would need inspections. And so with this transition, staff is looking to the board to kind of provide direction on how to proceed with the child care inspection services and kind of chart our path forward regarding that. Staff is of the opinion that with this change, all existing environmental regulations that are currently under HSA will go away. So we will be reverting back to essentially state NACs for inspections. They are not as stringent as some of the current today's regulations. So staff is of the opinion that we should go forward potentially and develop our own set of regulations and work with child care licensing to kind of, we would be responsible for the environmental standards, and then licensing would be responsible for the remaining piece of child care licensure, which includes the oversight of directors, the children, and so on and so forth. So I'll kind of open it up to the board for any questions. So
My questions, I'll start with, has to do with staffing. So let's talk, obviously this would mean, if I'm understanding right, you guys are saying we should take this on to make sure we actually have someone inspecting these homes. I tend to agree with that. However, I'm concerned about our staff, and Do we believe we have to hire another to do this? If we're bringing it on, how do we keep track to make sure our staff are not overloaded? And just make sure we're understanding those pieces of the puzzle.
The projected staffing, I think, is about a fifth to a quarter TFE, based on kind of some of the data we ran initially. Staffing, staff are kind of willing to kind of take this on and see where it goes. If we need to come back to the board with any additional updates at that point in time, I think we can do that. But I think the staff is willing to kind of shoulder that burden for kind of public health reasons. They think it's a good idea, and I tend to be in agreement with them, so.
My encouragement is to probably make sure that we see this maybe in 6 months, so we can see how things are going. Our concern is truly staff, making sure that our staff, we're not just dumping and dumping and dumping, because there's so much time of the day.
Okay.
So I would probably ask for that to come back at some point, that we're officially going to look at how that's going. Any other discussion or questions?
I have a question, Mr. Chairman. Thank you so much. You mentioned in the staff report that the NACs are less restrictive than the current regulations. Can you provide us a couple of examples that you see out in the field?
Let me see. I think I took, I believe one, do you? Oh, do you have an example? Or?
I do have an
Oh,
example.
go ahead.
And I might not quote this completely correctly. However, like in the current HSA regulations, we have a whole area about like fencing around a childhood playground. The NAC says that children shouldn't have unsupervised departure from the playground. So as you can see, actually being able to restrict the size of the fence, how close it comes to the ground, you're going to be able to.
For the record, this is Aaron Myers. I just want to make sure that.
Oh, sorry,
it's all
Aaron
good.
Myers for the record.
I just want to make sure. Thank you.
Yeah.
Sorry to interrupt.
So I think they're just a little more strict in, again, we mentioned kind of the plan review side of it. So currently, we would see any new childcares coming in, so we could ensure that fences are tall enough that all of those requirements are met prior.
Thank you, Commissioner Garcia.
Mr. Chair.
Reese.
Mr. Fida, I understood the presentation a little bit differently, I guess.
Mhm.
My understanding is that the state intends to now occupy this space, and the question you've asked this body is whether we also want to occupy the same space. So it's not that we're going to go out and do more inspections, it's a question of whether we should stop doing inspections and allow someone else to take on that role. Have I missed part of the presentation?
There is a few more pieces to that. So I guess kind of the state is kind of looking for, I think, is probably more a model as mimicked down in Southern Nevada, where they have environmental standards and design standards for these facilities, and they will conduct the annual inspections because these inspections are required to be reviewed by, or these facilities are required to be inspected by fire on an annual basis, by health, and by child care licensing. So there are multiple inspection pieces, and these and they will lean on the various bodies to kind of help assist that. So I know they're currently working with some of the fire departments to conduct inspections for these child care facilities as well. So that's another aspect that they're looking at. What they're looking at and what we're trying to kind of mimic is the Southern Nevada model, where there is our environmental standards. So we set the environmental standards, what meets essentially good environmental health, and they will kind of defer to us on all aspects that are environmental, per se.
So to be clear, are we adding work to our staff a little bit, or taking work away? That's really.
There will be added work, depending on if there is NACs that allow them to call upon a political subdivision for assistance in doing these inspections. So they may request us to do these inspections regardless of the final outcome, I guess, best way of putting it. So we could do it under the NACs, or we could do it under our set of our own established regulations at that point.
Well, Mr. Chair, my point is, one of the possible motions, which is number 2 in the staff report, is that we would cease doing these inspections.
We could give it back to the state.
What is the staff's recommendation? I am not a healthcare expert, nor do I perform inspections. So I am left trying to grasp what your professional recommendation is.
Our professional recommendations is to kind of set our own regulations. This will allow us to, one, tackle kind of more the plan review, set people up for success, and then also do the operational piece, provide more guidance that way.
But I'm not sure that that is one of the motions that you've given us to do, or maybe I am not understanding the ask.
I guess the ask is for us to kind of set up our own regulations and bring them back to the board regarding these child care facilities.
Okay, so
We haven't inspected some of these smaller facilities as well, so we don't really have standards to kind of compare them to. We would have to kind of defer to NACs. So.
well, then I suppose my question is for our legal counsel. I'm not sure that I'm prepared to move forward as it's agendized because I don't understand the ask. If it's not fully baked, I'm happy to move to continue this item. I want to support the staff. So, Mr. Fida, I want to do what you are asking to be done, but I'm not sure that we've been given the tools to do that today, which is my issue with the motions.
Could I? Try to, so I believe what the ask is at this point is beginning in July when the licensing for the child cares will go from Washoe County Human Services Agency to the state child care, that we continue to have our EHS staff inspect the child cares, including those additional group home child care facilities. And during that, after July 1, we would also be working to develop our own regulations. We would be inspecting to enforce NAC initially after July 1, and then we would develop our own regulations to bring back to the board for approval as we proceeded with oversight of the child care facilities in the future.
Well, Mr. Dick, if I may, then I still don't understand our role then going forward, because we have either to keep doing what we have historically done, but we modify it with new regulatory framework, or we say we're going to get out of this area altogether. And so I'm trying to figure out, you know, our EHS staff and our inspection staff are spread very thin already. They're doing so much. And so I'm saying, is this one of those occasions where we've been given some, you know, opportunity to exit this area, or do we want to stay in it? That's really, I'm asking the policy question now, which I think is what our board does, is the policy question, maybe not the other piece of it.
And if the, so I think on for the recommendation is that we think that we would provide better protection for the children if we're continuing to do the inspections and engage with that in developing our own regulations. If the inspections revert back to a state agency to do them, we would no longer collect the inspection fee that we have for those facilities, so we would be losing that revenue. And potentially, the county could be assessed for the cost of the state doing that EHS function. In other areas where the state provides the EHS public health services, they do charge those counties for the services.
Commissioner Garcia?
Thank you, Mr. Chairman. I had that fiscal question, so you answered that for me. The other question I had is our capacity within the EHS staff. Are we already familiar, trained up, ready to go to assume the additional responsibility to assess a different type of child care facility, which I think you referred to as a family care facility?
Yes, so we do, the best way of kind of grouping these is there's a small, medium, and large kind of categories for this. The medium category, there may be what they call a group care, and there's only one facility of those. A lot of these are smaller family cares taken at single-family residences. Our staff is trained to do the centers. They're kind of held to a higher standard. In order to do the smaller facilities, staff would kind of have to work to determine, essentially, set up a checklist almost, essentially, of critical violations and what to look for and how that's kind of documented. And I think Southern Nevada has some tools that they have shared with us on how they kind of do these smaller facilities, so.
So I'm a little confused as well, so I appreciate my colleagues' questions. So the state would assume the responsibility of like the staffing, the people, children on the facility. And then we would ideally keep the environmental health inspections going, and we would receive the assessments for those, correct?
Yes, so we bill the facilities for the inspection piece. So the child care facility, they look at it from a holistic standpoint. So what they're looking for is an inspection report from us regarding the environmental health. So are the playgrounds safe? Are they properly doing sanitation within the facility? Adequate space, restrooms, kind of the infrastructure piece, kind of is what they're looking to lean on us for in this case. And they look at childcare ratios, background checks, and that's kind of their element of that inspection piece.
So my last question, I think, on this, because I think your recommendation does flow with these. But could we, let's say in 6 months, we said yes to this. We get where we start doing this and we're like, this is more work than we can keep up with. That mean it's going to come back on us that, I mean, I get that children, we're going to have safe facilities for children. Obviously, we want that. But can we come back to the state at a later date and say, this is not working for us? You can have this back. We don't. Are we going to push us into a place where we have to midstream now hire somebody or do something, do you believe?
The state seems to be fairly flexible, but I don't know how the state would react. It's hard to speak to that piece,
Fair
but
enough.
they seem to be fairly reasonable, so.
Fair enough. So that's my only question, has to affect staff. And I think with you, I'm hearing you say you guys believe you can handle this.
Yeah.
Which should be recommendation, possible motion 1.
That is staff's recommendation. I talked to our staff regarding the staffing concern as well. And their thoughts are kind of, these are smaller facilities. They're not as large as child cares. There will be some growing pains, but hopefully we should be able to iron those out and continue to provide good public health, so.
Okay. Any other discussion? So we do have 2 possible motions that are on our agenda here. Does not mean we could not make another suggestion here. I mean, we are open to that. But I do see how number 1 gives these guys room to grow, and we can watch it. So with that said, do I have a motion on one of these motions or something else?
Mr. Chair, I'll
Yes.
move to direct staff to work with the State of Nevada Child Care Licensure Program for NNPH to conduct inspections of child care facilities to ensure a smooth transition for child care providers and work internally to develop NNPH environmental regulations for all child care facility types to be brought back before the board.
So we have a first, do I have a second?
Second.
Second, any more discussion? All in favor?
Aye.
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 Any opposed? I believe that passes unanimously. Thank you for the conversation.
No.
We do
Thank you,
want to
Board.
understand that. Okay, we are moving on to number 12, update discussion and possible direction regarding the FY25 Northern Nevada Public Health budget. And we have District Health Officer Kevin Dick.
Thank you, Mr. Chairman. So last month, I reported that we hadn't received any comments or concerns back from the city managers or county managers from the budget reviews that we had conducted. And we did receive concerns from Washoe County on our FY25 budget that were communicated to us after the county manager's recommended budget was presented to the Board of County Commissioners on April 16th. The county did not approve the $221,000 increase in the county general fund transfer to the health district. So this leaves the county transfer at $9.5 million, and that's an amount that has not increased since FY 2016. So when you adjust for inflation, $9.5 million in 2016 is equivalent to $12.35 million in 2024 dollars. So that's basically $2.85 million more than the county general fund transfer in their recommended budget. The county expressed concern regarding the structural instability of the Northern Nevada Public Health FY25 budget and future budget projections and the rate of spend down of the fund balance. The county was informed that the rate of spend down is significantly impacted by the increases in salaries and associated benefits amounts that resulted from the county's salary adjustments resulting from Corn Ferry compensation and classification review, and the increases in the contributions required by Nevada PERS. So these figures are approximately, for the Corn Ferry salary and benefits increases, approximately $1,066,000. That's just looking at positions that were filled when the Corn Ferry adjustments went into effect on August 14th of 2023. So the impact is actually going to be greater than that $1,066,000 when you look at positions that were vacant that have since been filled, but this is an approximate number for you. The PERS contributions also increased by approximately $900,000, so about a $2 million increase in cost for us between those two. The budget also includes a county overhead charge of approximately $2.5 million, and that's a $321,000 increase from what we had budgeted for county overhead, and that's therefore another $321,000 that was not included in our budget that the Board of Health approved. The county agreed it's not within their purview to interfere with the Board of Health's decisions and authority regarding the adjustments to salary allocations necessary for positions on federal grants that could no longer be fully supported due to the Corn Ferry increases or other small adjustments such as reclassifications and the moving some of the UST positions onto the inspection or the permitting revenue for those positions. They did, however, urge caution regarding new positions. And this is in alignment with our current thinking that has been presented before to the board when we've talked about the budget, that we would not rush to fill any new positions, but would wait for better information on what the ending fund balance is at the end of the FY24 fiscal year. Recognizing that the Northern Nevada Public Health budget cannot be structurally stable if there's no increase in the general fund transfer in the future, and that the county has not been willing to increase the fund transfer while the significant ending fund balance remains in the health fund, it was agreed it is necessary for us and the county to reach agreement on how the county fund transfer to the health funds will be determined and how it will increase in the future. And we're eager to work with the county leadership to have these discussions and reach agreement. We believe this marks an important milestone now to work together to find a sustainable path to the future revenue support necessary to provide the public health services our community needs. So the Northern Nevada Public Health budget and the county manager's recommended budget includes revenues of $29,291,715, which is a reduction of approximately $700,000 from what we had in the budget that we presented to the board. We believe this is due to grant revenue disparities in the FY25 budget that the county has put together. But we just received the budget information last night, so we're still trying to dig into where those discrepancies are occurring. The authorized expenses are at $34,809,478, which is I'm sorry, I think I got that number wrong. It's working on different numbers that were changing, and I don't think I updated it. Actually, that number is $35,386,374. And so that's about a $445,000 increase more in costs, more than the DBOH approved expenses due to the increased overhead charges and other adjustments to costs on the expenses. Without the $221,000 increase in the county transfer to the health fund, the $700,000 decrease in revenues that were adjusted by the county, and the increases in the county overhead charges and other expenses, the projected deficit spending is expected to be just over $6 million, $6,041,000 in the county's recommended budget. So that's an increase of approximately $1,365,000 from the budget that was presented to the board. So in this process of what we just received, we have less revenue than we had projected in our budget without any increase in the county fund transfer and increases in costs. So looking at a larger deficit that's in the budget. Again, though, this is all based on fully expending for every staffed position, includes the expenditures for filling the new positions that we're proposing, and we haven't made the determination to fill all of those positions. We'll be waiting to see where we end up with the fund balance and how that affects what our future projections look like.
Can you give one more piece of information before I open up? What is our new ending fund balance with the new, do you have any idea what that is?
I don't have that calculated, but I think I can do something pretty
Even
quick off
approximately,
the
that
top
might
of
help.
my head.
One of the things we're looking at, we know we have a high funding imbalance because of COVID.
So that would
some of that money.
So if all of that those funds are fully expended and based on the estimate to complete for this year coming in is where we're projecting the fund balance to be for FY24, that would leave us with a fund balance for at the end of FY25 of approximately about $7,300,000.
Okay, thank you. Okay, let's open that up for discussion. Mr. Reese?
Thank you, Mr. Chair. A couple of things. First, just as a general preference, I do not like to see us balancing our budget on the back of the ending fund balance, right? I think we should operate under a fiscal year budget that is balanced. If we have a fund balance because we've set aside money for, say, a rainy day, I think that's a better policy strategy choice. I understand that it looks like we have funds, but I think given where we are with some of the health issues that we've been facing and what we know is coming down the horizon, that fund balance will obviously quickly be used anyways, either way. So I'm worried about that. Second is I don't like, because I sit in a different jurisdiction in the city of Reno, I don't like to micromanage or criticize others' budgetary choices. So I feel somewhat difficult being asked to think about what the county's position is relative to our body. But because of the nature of the tripartite government, I suppose, we're asked to do that. So here at this body, I want us to figure out what the disconnect is between what our needs are and what the county perceives our needs to be and why, because all those numbers suggest to me sort of an unfairness to the way that we're as a board and as a body being treated. So I don't know if it's something where the county manager and I need to spend some time offline, thinking about what's going on, because I'm not privy to those conversations. I'm hearing what you said, Mr. Dick, but it's concerning to me because we cannot sustain the importance of this organization beyond basically another year with the fund balance that you've identified. And I haven't done the math entirely, but it means that if we had to have this conversation a year from now, and it was just the county saying we're not going to approve additional fund transfers, we would then be in the negative. We'd be talking about significant cuts to programming or staffing. So help me figure out what we're going to do to move forward, because again, it fundamentally sounds unfair to me, but I also want to recognize that I may not have all the information needed to make that decision.
Yeah, let me begin with, I think that some of the, what has led to the position we find ourselves in now has been resulting from the board, after many years of not appropriately increasing fees, doing so with a significant adjustment back in FY 2015. And so as that fee revenue then was increasing, the general fund transfer increase was not requested while that revenue source was helping to support the health district. We then were gaining a healthy fund balance, which we were looking to begin investing prior to 2020 when the COVID pandemic hit. And then we had the huge influx of federal funding to assist with the pandemic response that then just further boosted the fund balance that we had. And so with a large fund balance, it didn't seem like the area that the county needed to invest in for those years. As far as, and I understand your concern, I share it with the spend down of the fund balance that's occurring now with the costs that we have. The projection is for in FY ~27 that we would then have we'd be in the red for the health district by a couple of $1 million.
John. Dr. Novak, I should
Yes,
say.
no, it's all right. I am concerned that with a deficit this big coming up, that we don't have adequate funds if we run into another pandemic or some kind of emergency that we have never planned on. It really concerns me because I know exactly what happened the last time. And luckily, we had a big enough fund balance to keep operations going, because if we hadn't had that fund balance at that point of time, we couldn't have done what we did in COVID. Because the COVID money came after we had to make some major expenditures. So it really concerns me. And I'd love to table this thing, but with the way the year-end budgeting goes, I don't think we can. But I don't think I have enough really good information, since this is hitting Mr. Dick's desk yesterday or whatever, so.
So I think in looking at this, one is I want to say I appreciate the county taking the time to walk through it. I know you've had quite a few conversations back and forth. Every one of our jurisdictions are looking at similar budgeting issues of, I don't let our group say freezing any things, we're pausing some hiring, because those two words mean something different inside of our place, but taking some time. And this is kind of what we want to do, is sit back and look. Obviously disappointing that we asked for an increase and said we got a bill. That's not what we're really looking for. But at the same time, I know the county needs to be right side up. Just like as a city, I need to make sure I'm making those decisions as well. It's something that I'm not in. I didn't get to be in those conversations either. So we get to just kind of look at the out effects of what's happening there. I do think some robust conversations with the county need to be had regarding the future of what's there, because we're also looking at trying to get our state to fund some things. I mean, this is reality, and it seems that my fear a little bit is they're watching what's happening, and if county's not willing to fund during this time, is that a need? Is that a real need? Are we, or what are we doing? I also don't want us being caught flat-footed, as Mr. Novak mentioned, in the case of another emergency. I want to make sure that we're robust enough to be able to take care of needs. And so it kind of goes back and forth of trying to see. My big question to Health Officer Dick is, I know there's three employee opportunities that you're looking at. Can you pitch those for us? Their necessity? Is this something that you see as a large need? Show us where we need to go with that, because I mean every little bit does help.
Yeah. So we had 3 positions that were in the budget, and one of them is to transfer a technology business technologist position that is currently funded with COVID grant funding over to be a locally funded position for us into the future, and that happens to be Gloriana, right over there. We have 2 business technologists now, and Gloriana actually has the highest number of help desk requests that she fills of anybody that's by far that's responding to those requests. And so we really we can't function without that position into the future. The other positions are, one was a new supervisor for informatics and statistics to help to alleviate span of control issues that are occurring with supervisor within EPHP currently, and with our desire to develop more informatics capabilities. And the other position was to add another EHS specialist position to help with the expediting the plan reviews to try to meet the turnaround times that the local jurisdictions are asking us to achieve.
Understood. So for me, I mean, three employment opportunities here. Hiring 3 people isn't going to change the deficit here that crazy anyway. But I would say, being wise, my thought is potentially do the one piece that is a necessity and then hold and pause the other ones to look, as you mentioned, at what we're doing. So I do think that a more robust conversation that looks down the road with our county needs to be had. And so I look forward to having that. And Ms. Reese, I'll take you up on that offer to join me or however. And Ms. Garcia.
Thank you, Mr. Chairman. And for those of us that are coming from hospitals in different worlds, you probably didn't tune in to our last BCC meeting where we had the presentation from our budget office. And so I just wanted to kind of paint the general horizon we're seeing here and provide that context. And I see Manager Brown also walked into the room, so I'd like to kind of tee it up and welcome him down if he would like to highlight or elaborate on any of the items that I touch on. But basically, the high notes for those of you who haven't been watching or listening is that expenditures are increasing faster than our revenues, and we're particularly concerned with our C-tax flattening. It's causing a lot of concerns, and we're really starting to buckle down and anticipating those changes down the road a year or 2 from now. Collective bargaining is another element that's looming, and we just really don't know how that's going to shake out until it shakes out. So it's difficult to quantify that impact. We also know that federal funds are waning, but as you know, we're growing and our community needs are still increasing. So there has been a series of conversations that I have not been involved in, but I know that County Manager Brown, our Chief Financial Officer, Abby Yacobin, and our chair and Kevin Dick have been a part of. And so I haven't been involved in those meetings. I've been getting some of the email correspondence, which is why I would like for County Manager Brown to kind of talk about that. But what I gathered from a lot of different discussion over the last week is that there is a need for us to convene together and sit down, possibly, hopefully this summer, and have a more formal deep dive into what this relationship looks like. We are open to that. We think it's a great idea. Probably should have done it years ago, to determine scope and really effective and sustainable ways to move forward. So with that, Manager Brown, I'd be happy for you to chime in.
And Chair, just for the record, Manager Brown did sign up for public comments, so I'm going to go ahead and call that.
I'll give up public comments since I've been invited to the dais.
We'll give you 38 minutes.
I don't think we'll need that long. For the record, County Manager Eric Brown, it's a pleasure to be in front of you. I wish I had better news for you. As Commissioner Garcia said, and as you've seen in the comments from the health officer, the county faces a very tough financial outlook. This is the toughest budget I've seen in my 4 years here. So while it's not pleasant that you didn't get the increase in the transfer and some of the expenses are going up, such as overhead, those are things that are happening countywide. It is not something that is singling out the health district in terms of what's happening there. I do think, and I've had conversations with our board chair, Alexis Hill, and I do think it's appropriate that we find the opportunity to have a discussion about what does the future look like for the health district? What are your needs? Because I don't think that's thoroughly, I know it's not thoroughly understood by the county from a long-term perspective. So we don't have these situations where at the end of the budget window, when it's time for the board to make decisions, you're finding out the bad news at the same time that it's being delivered to the commission. I would say that in defense of our budget team, again, this was the toughest budget season I've seen. Normally, we would have cranked through those numbers earlier in the season and could have had conversations with departments about what we were thinking and what would go through and what wouldn't. Quite frankly, this year, there aren't any positions that have been approved that have not identified offsets. And that's the environment we're in right now. Our strategy, as agreed by our board, is let's take care of the people we have, make sure we don't have to let anybody go over the horizon. Let's make sure we maintain the services that the county provides and not have to cut services to our community. And let's use our reserves prudently. In that regard, as it relates to the amount of the funds transfer, we do that every year. So we don't take into account inflation as a budget principle at the county. Every year we look at what the needs are for the county and we allocate the available funds consistent with the direction that we received from the Board of County Commissioners as a result of our strategic plan priorities. That's how the monies get assigned. I think you all know that I've worked closely with the health officer and with the health district, many of you, on many issues. Health is front and center in terms of my thinking about how we serve this community. I do want you to know that there are discussions. Kevin and I were on a call yesterday with the State Department of Health and Human Services. We are talking about redefining the funding flows between the state and the county, not just for mental health, but for public health and other types of healthcare services. And again, I think that fits into a discussion about what is the scope of the Northern Nevada Public Health Charter going forward? Or is it going to change? What are the needs going to be? And what are the financial implications of that the county needs to understand as we incorporate our own planning? Our curve looks like your curve. That's what's concerning. So if you think that by not, and what I mean by that is if you think that we're not increasing the funds transfer because, and that's giving us some big bump in our fund balance, that isn't the case. We're looking at the same future that you are, and so we're very focused on trying to identify new ways of doing business to modify that expense curve. And we're asking all of our departments to do that, as well as obviously looking for opportunities to generate new revenue sources. So with that, I'll turn it over for any questions.
Sure.
Manager Brown, thank you so much for your kind words and being here kind of on the fly. First of all, let me be clear in my comments. The county has been an outstanding partner with the city of Reno and I hope with the city of Sparks. We are three governments that must work well together in order for this community to succeed. And I think what I've observed for the last at least 3 or 4 years is the county has stepped up in immeasurable ways, especially in the areas of human services. The CARES campus, I was there this morning, and just really, I tip my hat to all the work that you all are doing, and it comes at a cost, right? Because as the cities exited that space, you all took on that space. And so I am not faulting you for where we are. It's just that when we sit on this body, they ask us to wear a different hat. And that hat tells me that I'm worried about the concept that since 2015, there really have not been concomitant increases in the budgets or allocations towards this particular, and we aren't a division or a department, I suppose, of the county, but we are our own entity. And so perhaps what I am looking for is some maybe future commitment that we will figure out what model is appropriate, whether it's like the 474 Fire District model, or whether it is something that happens at the state. Because what worries me is that we would get to a moment where we couldn't fund the essential services that come out of this body, right? Whether that's vaccinations or related health issues, whatever it is, we have to make plans for that eventuality. And so, like you at each of our cities respectively, we're looking at declining C-tax revenues and different kinds of things, flat budget, I suppose. But what it means to us here, I suppose, implicates a very broad concern about public health. And because we've gone through a pandemic and the spotlight is on public health, we have, I think, some greater awareness, situationally at least, of what that means. And I'm not saying we have to plan for every potential future pandemic. I'm not suggesting that that's the issue, but I'm just saying we cannot have a long-term sustainable future if what really is happening is you're looking at us and saying, well, you've got a healthy fund balance, at least in this year, we have to move away from it. If that's really what happened here this year, it's just not sustainable. And so we're just kicking the can down the road for another year. So I am happy to participate in whatever way that the chair would see fit to include me in that. And for me, it's all happening in real time for me here on the dais too, because I wasn't aware of some of this or the depth of it until today. So again, continue to believe that you're an outstanding partner. Under your leadership, we've accomplished a great deal, and I'm looking forward to working with the chair and you to work on what we can to make this organization's financial stability be prioritized.
Thank you.
Any other? I want to thank you for coming and being here today too. And without question, I can say ditto. We love working with the county. We love, actually, the more we all work together, it's better for everybody in our community. And so thank you. I think I shared my excitement and disappointments already. And I get it. You know, I'm not responsible for what you guys do, and you guys have a purview of what you need to do. Our job here is to swing for what we need as well. And so I look forward to that conversation. And I would say the one thing, though, to our board is as much as we listen to this, we do get to make some decisions that are ours. And I appreciate even the concerns you share for us, because they are very real concerns. So thank you so much.
Thank you, and we're gonna take care of this. This is, you know, sometimes it takes the awakening to head in the right direction. I think we all want to go in the right direction. There's no question about that, I think, and I'm confident we'll get there. So, thank you.
I do agree. Thank you. Thank you. Do you want to share something?
I just wanted to say, I think right now is the moment when the numbers look the bleakest, because we are looking at a projected spending that will determine our ending fund balance at the end of FY24, and I think that projection is not accurate. I expect that the fund balance at the end of FY24 is going to be above where we're projecting it to be, and so that in the future we'll have better numbers as we move past the end of the fiscal year and get into the payment of reimbursements from grants rolling in and everything to true up what that number is.
Well, I look forward to seeing that real number. That sounds great. But I do think that we're at a place that we do need to move forward on this budget. And because of where we're at, these guys have to turn in budgets, everything has to move forward. We do know we have a couple years to work through this. But I still, with that said, with the caution we all know, I think there's a wisdom in us agreeing to this budget, but also holding on and pausing for the areas that we think we can, standing with you with the one area that we would go forward on. That would be my ask, but I don't know how anybody else feels.
Mr. Chair.
Yes.
I am reluctant to handcuff the district health officers' choices of hiring, meaning we can have a general policy preference that says we're going to try to observe vacancy savings, but I don't want to be in the position of saying, well, I want to pick that job or that job. That is not, I don't think, for me, the role that I observe at this level. So I'd rather just imbue the district health officer with the ability to make those choices, understanding that he's facing, and our new district health officer will face the same choices. And so, yeah, hold the line on whatever we want to call it, new spending, but I don't want to pick and choose which of the jobs to hold out or hold open.
I appreciate that, actually. I agree.
And I'm so glad you brought that up because the staffing wasn't really addressed in our discussion today. But my understanding, and correct me if I'm wrong, is that the county has said to go ahead and proceed with the staffing as you wish. However, the county transfer will not change. So what we're really looking for, I think, is to go ahead and adopt today's budget, and where it is loud and clear that with the onboarding of a new health officer, with the interest of being fiscally conservative, on both sides of the house, that we reconvene in the summertime to really dive deep into this issue.
I think it's very fair. Let it be known that Dr. Erika Dinkel had to leave. So I think what's been said sounds wise to me. But with that said, we do need a motion. If you would like, someone would like to read the official motion.
No, I didn't see one either.
We don't have one.
You don't have one? Just accept the budget as presented.
I move to approve and accept the budget as presented.
I have a first. Do I have a second? I have a second. Any more discussion? With seeing no more discussion, all in favor?
Aye.
Aye.
Aye. Any opposed? That does pass unanimously. And we are moving on to staff reports and program updates. And Francisco Vega, come on down, sir.
Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. In my report today, I did provide some updates in regards to EPA issuing some new standards for light duty and medium duty and heavy duty vehicles. As has been mentioned many times here, one of the biggest sectors contributing to air quality in Washoe County is transportation. So anything that we can do in that area is a good step forward. So we appreciate the federal EPA taking those stance. I did also want to mention that EPA is taking comment on the NOx standards. Again, I made a commitment to the board to keep them up to date, or keep you up to date on what's going on with the standards. And in this case, EPA, like I said, is taking comment on the NOx standards. That is my update, and I'm happy to answer any kind of questions.
Any questions? Thank you, sir. Appreciate it. And we're moving on to Ms. Lisa Latritz.
Good afternoon, Lisa Latritz, Division Director for Community and Clinical Health Services. You have my report, and I'm happy to answer any questions about that. Just two highlights. Our immunization team is kicking off our school-based clinics today in preparation of back to school. So they are at Dilworth Middle School this afternoon. There will be 2 more school-based clinics in May, and we will also have a family health festival in May on May 22nd. And our divisional update this month was on National Sexually Transmitted Infection Awareness Month. Just to let you guys know, we are at 5 congenital syphilis cases to date in 2024. Our staff presented at the Northern Nevada Infection Control meeting in April, I believe it was the 11th, and gave a great presentation on congenital syphilis and reporting and testing and what we need to do in our community. And I'm happy to answer any questions.
Any questions? Yes, Ms. Garcia.
Thank you, Mr. Chairman. Thank you, Ms. Latritz. I know that the news about Immunize Nevada has kind of shaken things up throughout the state of Nevada. Can you talk to the board about some of the initial implications for us in your division?
Yes, of course. So what that means for us is at these events, like such as today, where we would have that support from Immunize Nevada, this is the boots on the ground impact for us. They're usually there helping with getting registration completed, directing where clients go based on their pay source. We no longer have that. So what we're having to do is take our own staff with us, which takes away from our resources here. And so we have adapted, and we're taking 2 to 3 plus supervisors if need be to these events to make sure that we're serving our clients like we always did. The other would be, back to school. We're nervous on how that's going to look, but we're starting early and engaging with our partners, how we can get this done, and definitely communication with the state on what they need from us. How can our jurisdiction help to take over some of the things that need to be covered?
Thank you. Thank you for that update.
Thank you.
We have Robert Fida, Environmental Health Services.
Good afternoon, Board. Robert Fida for the record. You have my report in front of you. So with it, vector season coming around the corner, I kind of wanted to highlight some of the vector work we've been kind of have on deck. Staff is setting up a helicopter treatment mid-May, so they're planning for notifications to go out shortly. And that staff is also working on some burrow dusting for ground squirrels in a couple of the parks that have high ground squirrel populations. The other thing I did want to bring to your attention is that the Rose Mountain water system, they are currently being set up for formal enforcement for the state. The operator announced their intent to leave, so they are kind of without an operator. And the Nevada Public Utilities Commission is currently involved in trying to find a new owner for this water system. But currently, we're working with the state. We are documenting in case this system does need to go towards formal enforcement by the state. So, but those are kind of my quick updates. I'll open it up for any questions.
And you say that was Rosewater?
Rosemount.
Rosemount.
Yes.
Thank you. Thank you. Any questions? Mr. Novak.
What's the status of Rome?
I believe they had their first flight with full setup. They did a test flight this week. I want to say Tuesday. So we're hoping that once we get some piloting done, I think all the permitting's done. So now they're just training now. So.
Very good.
A
Ms.
quick
Garcia.
follow-up to that, just because another commissioner on the BCC
Mhm.
asked a question specific about the vector-borne disease program. So the drone is almost ready to go. Will that replace the operations for the helicopter treatment program, or will they be done in tandem?
It'll be in tandem. There are different tools in a tool belt kind of thing. The helicopter allows for wide area kind of treatment. The drone is more kind of like a targeted strike approach kind of thing. So idea would be to kind of prepare the area with a large area larvicide treatment, and then use kind of spot treatment for the drone during the season, and then additional wide area larviciding as needed. So.
I just want to comment too. I like the idea of both just for backup, so we don't have the news media like we did last year. So if something goes down, we know that we have something to do. We can get out there and do something. So thank you. Very good. Thank you so much.
Thank you.
Dr. Nancy Dow, Epidemiology and Public Health Preparedness.
Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. You have my report. I have nothing to change or add, just a few highlights from this month. In public health preparedness, we had a very fruitful exercise week, the week of April 8th. The preparedness program coordinated and hosted a combination tabletop and full-scale exercise over a 2-day period from April 9th to 10th.
Planning for the exercise started almost 8 months ago, and the process included many community partners and subject matter experts with a goal to test out response capabilities for a chemical incident. Day one was a tabletop exercise that included various participants from partnering organizations to set forth the scenario and have a facilitated group discussion regarding immediate response steps. And then day two was acting out simulated scenarios and optimizing response efforts and minimizing the risk of escalation during actual chemical emergencies. So this multidisciplinary chemical exercise was a comprehensive initiative aimed at strengthening the collective response capabilities of our stakeholders, focused primarily on EMS and law enforcement, response, decontamination procedures, and laboratory capabilities, and hospital preparedness. And this exercise serves as a very crucial platform for enhancing collaboration, refining protocols, mitigating the impacts of chemical emergencies in the region, and we have an after-action report that's in the process of being developed post-exercise, as typical for our exercises. And then on April 11th, our healthcare preparedness staff led and coordinated an alternate care site tabletop exercise at the Regional Emergency Operations Center. Emergency managers, legal representatives, and hospital leadership exercised updates in the plan for best practices and lessons learned. And during the tabletop exercise, there's various areas of improvements that were identified and will be worked on and to be incorporated into the plan. And in epidemiology, flu remains below regional and state baselines at this point, with flu B still dominating. Outbreaks also continue to decrease further in the month of March and thus far in April still. Earlier this month, we circulated the CDC health alert on highly pathogenic avian influenza H5N1 virus due to the identification of a human infection following exposure to infected dairy cattle in Texas. This is the second human positive of H5N1 in the US, with the first case reported in 2022 due to contact with infected poultry. So the viral sequence from the patient specimen compared to that of the cattle showed that both cattle and human sequences lack the changes that would make them better adapted to infect mammals. So in other words, current risk to the public is low. Also, the virus is closely related to two existing H5N1 candidate vaccine viruses that's already available and could be used to make vaccines if needed, if there ever is an outbreak. And that's all my update. I'm happy to answer any questions.
Thank you, thank you. We like to hear that things are low, so keep those reports coming. Fantastic. Any other questions? Okay, thank you so much. Thank you for your report. And this is officially Mr. Kevin Dix, our district health officer's last update. And he's going to retire. So you're going to sing this one? Do more of a rap song?
No, I wasn't planning, but I'll try to stretch it out as long as I can.
Go for it.
I wanted to give a few updates for my report. One is on April 8th. We had the pleasure and opportunity of jointly presenting with the Southern Nevada Health District, Central Nevada Health District, Carson City Health and Human Services to the Interim Committee on Health and Human Services to talk about some of our priority areas and also to communicate and inform them of the areas that the board had approved for us to make investments of the SB 118 funding. I think overall the presentation went very well, but with the exception of how the Southern Nevada Health District's proposal for SB 118 fund expenditures was received by the committee, and they questioned some of the investments that Southern Nevada Health District was proposing to make. And also, we had included spending some funds to try to reduce barriers for street food vendors within our budget, and they were also questioned on why they weren't expending anything to try to do work with street food vendors out of that funding. So There was a comment made about them bringing a budget back to the committee, but haven't heard if that will be occurring or not. I believe the next meeting is on the 13th of May. Also, the EPA released the new PFAS rule on April 10th, and I included EPA's fact sheet with my report to provide an update on that. But basically, they've set now drinking water standards for some of the specific PFAS chemicals at very low levels of 4 parts per trillion or 10 parts per trillion, and also an approach for how to assess if there are more than one of the PFAS chemicals present in the drinking water to assess what are acceptable levels. So the timeline on this is that the regulated public water systems have 3 years to complete their initial monitoring for these chemicals. They need to include the results in their annual water quality reports to customers. And then if they detect PFAS above the new standards, they'll have 5 years to implement solutions that reduce PFAS in drinking water. And I've also included the website address that the Nevada Division of Environmental Protection has that has information on PFAS in Nevada and PFAS sampling results from sampling that's been conducted. I know that there has been concern that citizens have expressed about PFAS in Swan Lake, and I looked at that data, and there was no new data reported from surface water sampling for Swan Lake. So, but this is a rule that people have been anticipating for quite a while. Now we have this. It's limited to drinking water, so no standards in the rule set for surface water quality. I had the opportunity to participate on a tour out to Pyramid Lake and along the Truckee River that was organized by a group, River Justice, that is formed by members of the Pyramid Lake Paiute tribe. And they took us and toured the hatchery and Marble Bluff Dam operations, and we met at the museum to talk about some of their solid waste concerns and their efforts to do river cleanup. So I'm hopeful that we can expand our partnerships to be able to work with this organization in the future through our solid waste program. As you will recall, April 11th was the day that the Board of Health met to do your duty to approve the contract for the new health officer. Commissioner Garcia joined the tour at lunchtime at the museum. I don't know if you want to share what you said to me when I walked in.
I can't remember what I said, but I said, while we were taking care of business, you're over here checking out the hatchery, I think is what I said.
I couldn't do the morning tour because I was at the meeting you made me go to. So that was kind of fun. But sorry you missed the morning. It was a beautiful day, but I really appreciate you approving that new contract for the health officer. And then lastly, we had a fun event at the School of Public Health, ribbon cutting for their new building at the Brigham building that they have completed the remodeling of. And this is a big step forward for the School of Public Health, where they have they still are in different buildings on the UNR campus, but have been over in the Lombardi Rec Center. And now they have a building that's their building. And so it was a nice get-together, several hundred people that attended, including our chairman and a number of members of our leadership team at the health district. And Christopher, Chairman Dare, provided them with, I believe it was a proclamation from the city of Sparks and a chairman's certificate of recognition from Northern Nevada Public Health. So that concludes my report. I'm happy to take any questions.
Thank you, thank you. I don't know if we have tons of questions, but I think it's in order if anybody would like, I mean, if you have a question, let me know, but this is Kevin's last time on the dais, so we can turn this into one of those burn you moments, or what is that called when we, no, I'm just kidding. But we want to say thank you. Who wants to start?
Well, I'm happy to start, Mr. Chairman. Mr. Dick, it's been an absolute privilege of a lifetime to work with you. Absolutely a joy, and I've learned a tremendous amount from your leadership. It's not been an easy job, I know, and it's certainly the last, let's say, 5 years have been particularly challenging, but I've watched you under pressure, and I've watched you shine, and so thank you for leading this organization for so many years and for being the kind of leader that we all want to exemplify. I appreciate it very much. I think there'll be other opportunities for us to toast you later, so I'll keep my remarks short, but just say thank you from all of us at the City of Reno for all the work that you've done.
Thank you very much.
Mike?
Yeah, I'd just like to say ditto, but also, Kevin, you know, we've been together 2015, I think is when I came on the board. And it's been both educational, I think for both of us. We've learned a lot during the pandemic. Spent a lot of time together. I know Dr. Novak, as well as many members that were here during that, you know, there was a lot of time spent here, but also on the phone and at meetings. And you showed that you had the leadership capabilities to make things work. You trained a lot of us, but I also believe you received a lot of training as well. But thank you very much for everything you've done. It's been a pleasure working with you.
Well, thank you. If I might add, 2015 was there was a lot of tension going on still around EMS services and whatnot. And I remember meeting with Chief Brown soon after he was appointed, and I said to him, you could either be my worst nightmare or one of my best board members. And I'm really glad he's turned out to be one of my best board members. So thank you.
Kevin, I just want to thank you. We had quite an opportunity together in 20 and 21 when he was chair, and it was quite an experience to go through, and I really appreciate the partnership and the advice and how it turned out. We did okay for flying by the seat of our pants.
Never forget it.
Nope.
And as the newest board member, I think, to this board, I haven't had as much time, but as an outsider looking in, I can't imagine the amount of pressure and stress you were under during the pandemic and being that forward-facing person. And I don't think the community could ever say thank you for helping us get through that along with the board during some very difficult times. But I think you're leaving a strong legacy in this example of how you can start with, you know, just an entry-level position and work your way through an organization, leading up to how many years of service are you at now?
In my career,
Yes.
about 38.
38 years. And then in EHS when you started there?
In air quality,
Or
I
air
started
quality,
in
my apologies.
2010.
In
So,
2010.
yeah,
Yeah.
11 years as the health officer.
Well, it's a great example of how we can invest in our staff and help build capacity so that they could be our future leaders. So congratulations on a term well spent, and it's been a pleasure.
Thank you.
And I just want to say it's been a joy, and there'll be more things said later, but I think working with you since I started in office. So this is one of my first board meetings I had as a city councilman outside the city. But I want to say to the staff, one of the things that I look for in leaders is not just what they do, but who they put around them, what they create. It says a lot about who you are, and I think we have an incredible staff that you help train up, put around you. So with that said, kudos to you, and thank you to everybody. I think it's going to be an exciting years to come, and now you get to go fishing and hanging out and all that good stuff. So, but thank you so much. Anything else you want to say before you adjourn?
Yeah, thank you all very much. It's a great organization, and you have been a fantastic board. I've really appreciated the opportunity to work with you and all the support that you've provided me over the years.
Thank you so much. We are officially
Chair?
adjourned.
Oh, sorry, Chair. I was just going to say Dr. Clacken.
Oh,
is
Dr.
also-
Clacken, forgive me.
Yeah, I didn't get my chance here.
Oh, no. I officially opened back up.
Well, I appreciate that. And, and I think, to reiterate not to go in and reiterate all the comments you just heard, but Kevin, I just wanted to go back, and what I think about is back in 2021 when I came on board and we had that orientation meeting, you and I really think about how much information you gave me at that time. And I was very appreciative that the time you spent to get me off to a start here, but you forgot to mention all the stuff about the pandemic at that time. And you were taking a lot at that time. And so you hung in there. And so anyway, very grateful for what you've done for me and for the community. Thank you.
Thank you, Dr.
Thank you.
Clacking. Sorry about that. So now we are officially adjourned.